Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So I wanted to start with a discussion on immune therapy. Your doctor might tell you that they recommend immunotherapy for your treatment. And if we think about immunotherapy, I think it's important to understand that in all of the historical treatment of cancer, and melanoma is a type of cancer because it's related to cells that are dividing abnormally. But what happens is in normal cell division, a cell goes from 1 to 2 and from 2 to 4. And if there's a damaged cell, it undergoes something called apoptosis. And apoptosis means it self-destructs. So if it makes a bad version of itself or bad copy of itself, it will just destroy itself and disappear, and that bad copy goes away. It was like a mistake. You hide the mistake and it goes away, and it never ever happened. But what happens in melanoma and other cancers is that cancerous cells keep dividing even though they are mistaken. So if a cell divides and it shouldn't have divided, in theory it should just go away, but in cancer those cells continuously divide and divide and divide, making many, many abnormal copies of themselves. And we don't want that growth to happen because that's called a tumor or an abnormal growth. And in the case of melanoma, there are different signals that cause these cells to grow and divide and keep growing when they shouldn't be growing and dividing. And so the idea of immune therapy is so that the body's own immune system can police this type of abnormal growth and hopefully destroy the cancer cells. And this theory was originated in the late 1800s by this gentleman, who's Dr. William Coley. He was a bone and soft tissue surgeon that dealt with cancer patients at the turn of the century. And here's a picture of him from actually a Christmas party in 1892, of all things. And he was noticing that when he treated patients like this gentleman around the turn of the century with a big tumor under his right ear, what would happen after surgery is that some of these patients would have infections because they didn't believe in antibiotics in the same way that we give antibiotics now to treat infections. And when these patients had bacterial infections postoperatively, their immune system would go into overdrive, and that would result in them having, in some contexts, a lot of fevers and chills and being unwell because of the infection that they were dealing with. But very interestingly, some of their tumors spontaneously went away. And so this Dr. William Coley thought, well, that's really interesting. If we can find a way to turn on an immune response, and historically that was only done by these bacterial infections. Now we have drugs that know how to do this. But historically, if we can find a way to turn on an immune response and help cancer regress, then we're really on to something. And that's the principle of immunotherapy. And this is a cartoon also of what is seen with a certain kind of electron microscope. And you can see a cancer cell, this red cell in the middle looks kind of like a meatball, and a certain cell of the immune system called a cytotoxic T cell coming in, extending some tentacles and trying to destroy the cancer cell. And so all immune therapy does is try to enhance everyone's immune system that fights off bacteria and viruses, and the intent is to also fight off cancer cells. And so how does that work? How does an immune therapy approach tell T cells to go kill a cancer cell and kill melanoma? This is what it looks like under the microscope. And at the top is a tumor. And at the bottom, all these tiny little purple dots are little T cells or lymphocytes that kind of go in, and think about them as an army rushing forward from the bottom to the top of the screen, percolating amongst the tumor cells and trying to kill them, like I showed you in that last example. That's what we want to happen. We want our own body's immune system as an army to come and seek and destroy the melanoma. And there are a lot of strategies that try to do that. But why doesn't it work all the time? Why isn't our immune system already trying to kill the cancer cells? And why does the melanoma even exist in our bodies in the first place? And the purpose of that is that because think about this as a melanoma. Melanoma comes from normal melanocytes, like I talked to you about in the beginning when I showed that cartoon of how that works. And these normal melanocytes are part of our normal body tissue. And so sometimes tumors are hard for the body to see immunologically. The immune system is looking for bacteria and viruses. It's not sometimes looking for normal melanocytes that have gone rogue to become melanoma. So here's the tumor. It's kind of hiding out in normal, healthy tissue. So what we want to do with our treatments and our different combinations is to make the tumor look different. So this is the antigens that a tumor may be expressing on its surface to make it look differently to the immune response. And when it looks differently to the immune response, that's when the immune response can recognize it as a foreign material, like a bacteria or like a virus that needs to be destroyed. And then the immune cells come into the tumor microenvironment, those little purple dots like I showed you on the last slide, and release a lot of substances to seek and destroy the tumor cells. Now, there are a lot of different ways that we can enhance this normal anti-tumor immune response. And one of them is through drugs that make the T cells work stronger. How does that work? Well, T cells are normally kept perfectly in a lukewarm situation. So if you're thinking about heating up the bath water for a kid to go in the bath, you don't want it too cold, you don't want it too hot, you want it just the right temperature. And so T cells can be too hot, and that means the immune system is too on, and that means that you have autoimmune disease, or they can be too cold, which means that you may be susceptible to infections and additional cancers. So these T cells are kept in this perfect equilibrium or in a lukewarm temperature by go signals on the T cell and by stop signals on the T cell. And if you stop the T cell by enhancing the activity of these stop signals, that's a way to turn down the volume. Or if you want to turn up the volume of the T cells, different drugs stimulate these go signals. And so a lot of the immune therapy strategies that we're giving to patients with cancer block these inhibiting molecules and thereby make the T cell work more strongly. So think about it as taking the brake off of your car. You're going to drive a lot more quickly because you can't stop. And so we want the T cells to fight the melanoma harder. And the drugs that are FDA approved for melanoma, including pembrolizumab, nivolumab, and ipilimumab, and I'll talk about relatlimab later, these drugs act by blocking these stop signals on the T cell, and by taking down the stop sign, taking off the brake, blocking the negative signal on the T cells, that makes these T cells actually work harder. There's a new drug that was just approved by the FDA in 2022 called relatlimab, and this is combined with a drug called nivolumab. Relatlimab blocks another stop signal on T cells called LAG3. You can see LAG3 at the bottom right of this cartoon. And I wanted to mention incorporating relatlimab plus nivolumab was shown to be better than nivolumab alone. So we have now 3 different places on a T cell that we can enhance the efficacy of the T cell response against melanoma tumors. It can shrink melanoma in the stage 4 setting, help people live longer, and in the stage 3 setting, it can help prevent melanomas from recurring. We don't yet know in the stage 3 setting of people that have had surgically resected stage 3 melanoma if immune therapy helps people live longer, but it does help prevent their melanomas from coming back.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.